السلام عليك يا سيدي يا رسول الله وعليكم السلام يا سيدي يا حبيب الله. السلام عليكم ورحمة الله وبركاته. Most of you already know that I'm a practicing doctor, GP, and also the clinical lead in Bradford Royal Infirmary, A&E. I'm today going to take some of your precious time for a very important message. And please, I would like for you to pay close attention and listen attentively. And the message that I give you today, please take it back with you to your family and friends after this Jumma. The Quran ayat that Allah mentioned, "O you believe, obey Allah and obey the Messenger and those in authority among you." The Prophet ﷺ also said that if you hear of an outbreak in a land, do not enter it. Or if the plague breaks out in the place where you are in, do not leave that place. Now, bearing these two very important messages by the Prophet ﷺ, I want to talk to you about the recent outbreak of the COVID virus, which is known as COVID-19 or the coronavirus, and how it affects us as individuals, us as a community, and us as Muslims, and what advice there is out there right now. I'm going to talk to you very quickly about what this virus actually is in itself. It's a virus, there's no cure for it, there's no vaccination at present for it, and there's only treatment to control the patient's symptoms as we speak. Initially it broke out in China, but right now it's a pandemic across the world. It's an international worldwide emergency, and as you're aware, it's an international emergency also in this country. What does it mean for us? The Chief Health Officer at the moment in time has moved from containment, which is to control the virus in a small population, to stop the spread of the virus, to slow this down. This movement from containment to slow down is really important to understand, because all the messages that you're going to be getting from NHS, Health, BBC News, all these news, they focus on this. The reason why this is so important to slow down the virus is because it affects some people more than others. Who affects the most it actually in time affects all of us at some point, like influenza. That's the current thinking. But those that affect the most seriously are elderly people, people above the age of 60, I'm talking about death here. People who already have severe conditions like COPD, asthma, heart disease, stroke. These people need a lot more intensive care compared to young people, young adults. But that does not mean it does not affect young people and young adults. Why are we talking about this? Is because there's something you can do, we can do, and the community that we can do to help control this to a degree where we can handle this as a community. So what am I asking you to do? The current advice from the NHS is that if any one of you, any individual, has a cough, a cold, a fever, you're short of breath, your body's aching, and you think you've got what we call the flu, if you have any of these symptoms, stay at home. Stay at home and self-isolate. By self-isolate, we mean stay in a room by yourself to a degree, and stay at least 3 steps, which is 2 meters away from your family and loved ones as best as possible. What will you do if in situations you get more poorly from this is that you ring 111. The self-isolation is 7 days minimum. And then take the 111 advice after that. I'm not going into too much detail. What do we do here? Please do your wudu before you come into the mosque. Try to read your nafil sunnahs at home. That reduces how much time you're spending in large congregations. This advice may go on to change. Aim to read and avoid. Aim to avoid the social contact. What we mean by that is handshaking, hugging, kissing hands with ulama. All these are really good deeds. But in the situation Mufti was speaking about before, preservation of life, it supersedes all of these good deeds. Preserving your brother and your kin is more important than gaining nafil and sunnah swab in this situation. And it actually is more better and more rewarding that you take the advice of health professionals to preserve life in this situation. Also, when you listen to advice that is coming through, you heard the brothers will test, the doctors will test your temperatures. Why? To check if you're safe to come to a public gathering. The Prophet ﷺ, the hadith I was reading earlier was about this. If you know the plague and you're affected, stay where you are, i.e. in this situation, do not stay in your country because you're in your country, stay home. The advice from the NHS fits the advice of the Prophet ﷺ, who actually gave this 1400 years ago. What else can you do? There's things that you can do individually to break down the virus and kill it. Simple things, soap and water. Soap and water kills the virus like no other drug or medicine or even alcohol gel. Even people trying to hoard alcohol gels, using alcohol gels incorrectly keeps the virus on your hand. How best to do it is wash your hand with soap or warm water at least for 20 seconds up to your wrist, and any contact you had with metal surfaces, clothes, or the people's hands will kill the virus and preserve your life and those around you. Then also use hand sanitizer gels. If you've got a cough cold, use handkerchiefs. Basic health advice. Use something to cover your face, bin that tissue, and get rid of, in the first place, you're not going to start gathering with them symptoms. Also try to avoid close contact. I'll give you a definition of close contact. 3 steps away from people that are at risk or your loved ones at home. Now, if you have these symptoms continuously,
अगर आपकी जुबान में थोड़ा बोल छोड़ तो ठीक है, ऐसा कुछ समझ भी नहीं आता।
अब सुन्नतें पढ़नी है ना तो उसमें गैप कर लें एक साफ का। बाहर भी बड़ा हाल है क्योंकि बाद लोग काम से आते हैं तो वो जो है उनके लिए वो पढ़ना ही चाहते हैं, तो यहाँ पर एक दूसरे से थोड़ा सा गैप कर लें। और फर्ज जमात तो हम मिलकर ही पढ़ेंगे, लेकिन उसके बाद आप जो है तो पूरे हाल में फैल सकते हैं, बाहर पढ़ सकते हैं।
So practically how to attain that, to read Sunnah, you have to then here keep a nice distance gap from each other. The other advice is that don't keep touching your nose. This habit I know of difficulty. Don't keep touching your nose, your eyes, and touching other people because you're spreading the virus, and this is how most viruses are spread anyway. So other than self-isolating and going through basic health measures, keep in touch with Markaz Ul Islami. You can register your number. We will keep you up to date. We are looking. Another message has asked for Urdu advice. We'll be producing leaflets in Urdu and short videos about everything I've said today. The reason why I wanted to speak English today quickly was because we are short of time and we should get the message out there quite quickly. There'll be short videos coming in Urdu, hopefully Hingo, Arabic and Bengali language, inshallah, from Markaz Islami. Please register your numbers with the brothers outside and hopefully we can get the message out so we can be safe as individuals and as a community. I mentioned to you earlier why I said slow down is really important. So NHS, our hospital me and you share where we work, there's a limited number of beds. Yes? If imagine everybody got the virus together and loads of people became poorly together and quickly, then number of beds will still stay the same to a degree. The number of beds will be taken by people with this virus. But people with other conditions now they will suffer because people will be turned away at the door. This is not something that we are imagining will happen. This is happening currently right now across the world, especially in Italy. As a European country, they are turning away people and people are going home simply to die because there is no other alternative for doctors or the health professionals. This is why slow down. How are you going to achieve slow down? By following the advice I've given you. If you've got a cold, isolate yourself. 7 days minimum, get to the doctor at the right time. One advice. Large gatherings, social gatherings, keep your ear out for the news. Things may change. The government policy is changing regularly. If they do decide to cancel Jumma, to cancel Janazah in such a degree, this will be explained in due course, and there are religious fatwa for this that stand light and will hopefully here to help us and preserve life, and also complement our deen, that we are preserving life, and nothing will be done that's against our deen, so please do not panic. Please do not worry. My last message to the community, there's a lot of things that happen in the community, especially the elders. If you are self-isolating, but there are people in your community, your neighbours, your relatives who are old, who cannot get to shops, people are hoard buying things right now. Although you're hoard buying, that's understandable because you're trying to protect yourself. I'm hoping those that have bought a lot of hand gels, soap, food, that they're going to share this out when, if, I hope not, if the situation with the scarcity of these sort of resources. Although what I'm saying sounds alarming, it sounds worrying, and it sounds like we're speaking something that's not going to happen, I'm not joking. Only 2 weeks ago, we did not know the hospital would be in the situation that they are in now. Naturally, there's a lot that I cannot share with you, but be reasonable and take the advice that I'm offering you today, and as an institution that we're offering you, because this is a serious situation. But in a serious situation, actions taken wisely, carefully, with patience, without panic, produce the best results. And hoping, inshallah, the slowdown with immunity in the public, that we will not see what we're seeing in Italy right now, where doctors decided between life and death. Although Allah decides this, but in terms of treatment, who we put on incubator in ICU and who we do not put on ICU. Because at the end of the day, it's going to be one of me or you, people that you know in this community, and people that you will hear about, and at large is our national community. I hope what I've said has been clear. If anyone needs clarification, I'm more than happy. I'll be around afterwards, inshallah, and I will help you with further advice.
یہی ڈاکٹر صاحب کہہ رہے تھے کہ ہمیں احتیاط کرنی ہے، اور کیونکہ یہ ایمرجنسی میں کام کرتے ہیں، انہیں پتہ ہے کہ ہاسپٹل کی کیا سچویشن ہے. سب سے پہلی بات تو یہ ہے کہ اللہ سبحانہ و تعالیٰ کے محبوب نے ہمیں پہلے ہی یہ سکھایا ہے کہ کھانے سے پہلے ہاتھ دھو، بعد میں ہاتھ دھو، اور یہ چیزیں ہمیں اپنی پریکٹس میں لانی چاہیے، اور ہمیں جو ہے اس کا خیال کرنا چاہیے. اگر کسی آدمی کو تکلیف ہے، بخار ہے اور اس قسم کی چیزیں ہیں، تو اسے اپنے گھر میں بھی احتیاط کرنی چاہیے، اور یہ بہت ضروری ہے. اور انتہائی ضروری یہ چیزیں ہیں کہ ہم اس وقت جو ہے تو انتہائی سمجھداری سے اس صورتحال کا سامنا کریں. تو یہی ہے کہ بہت زیادہ جو ہم ہاتھ ملاتے ہیں، یہ کرتے ہیں، وہ کرتے ہیں، ٹھیک ہے، یہ ہمارا مذہب ہے، ہمارے اس میں ہے، لیکن یہ فرض نہیں ہے. اور اس وقت جان بچانا جو ہوتا ہے وہ فرض ہے. جان بچانے کے لیے بہت ساری چیزیں جو ہے اللہ سبحانہ و تعالیٰ ہمیں اس کی اجازت دے دیتا ہے. جس طرح جان بچانے کے لیے حرام ہے، بالکل حرام، مرا ہوا جانور ہے، لیکن انسان کی جان بچانے کے لیے وہ کھا سکتا ہے. تو اس لیے ہم جو مستحب یا سنت چیزیں ہیں انہیں کیوں نہیں چھوڑ سکتے. تو یہ اس وقت ڈاکٹر صاحب کیونکہ کوالیفائڈ عالم بھی ہے، اور انہیں پتہ ہے کہ یہ کیا کر رہے ہیں. ابھی جو گریجویشن آ رہی تھی وہ بھی ہم نے پسپون کر دی، اور یہ ڈاکٹر اس میں گریجویٹ ہو رہا تھا اسلامکلی. تو یہ بچے جو ہیں الحمدللہ یہ ڈاکٹر بھی ہیں، اور اس کے ساتھ ساتھ یہ علماء بھی، اور آپ کی خدمت کے لیے یہ اپنی اپنی جگہوں سے اٹھ کر آئے ہیں آپ کو پیغام دینے کے لیے، ورنہ یہ کام کرتے ہیں. تو اللہ سبحانہ و تعالی ہم سب کی حفاظت فرمائے، اور سارے انسانوں کی اللہ حفاظت فرمائے، اور اس جو وبا آئی ہوئی ہے اللہ اسے اپنے کرم سے دور فرمائے.